Welcome to Behind the Genes. How is genomics changing midwifery? And what role are midwives playing in shaping the future of genomic healthcare? Also, do midwives just deliver babies, or is their role much broader than many people realise? My name is Sharon Jones, and in this podcast we cover everything from cutting-edge research to real-life stories in genomic healthcare. Joining me today are Katie Handley, Fiona Smith and Jess Fletcher. Katie is maternal and child health clinical lead for the Generation Study. Fiona is a research midwife for the Generation Study at Rosie Hospital in Cambridgeshire. And Jess is a safety and quality midwife at the Rosie Hospital and a participant on the Generation Study. Together, we'll be exploring how midwifery is evolving, where research fits into clinical practice, and what genomics mean for maternity care now and in the future. We kicked off this one by asking Katie what roles midwives play day to day.
I think when people think of midwives, they think of helping a lady to have a baby. We're there for the birth, we're there to catch the baby, but it is so much more than that. We're there from the moment a woman becomes pregnant, or even before that. We can help with prenatal, preconception care. We're there all the way through the pregnancy, for the birth, and then afterwards as well. We'll look after the lady, her family, until we hand the baby and her over to the health visitor or to whoever's next in her care pathway. But that's just looking at clinical midwives that are involved directly in that particular pregnancy. There's midwives doing all sorts of other roles. I think I'm a really good example of that. So I was a clinical midwife. I am a registered midwife, but now I work as a clinical lead. So I'm using my midwifery background and my midwifery skills in a research environment, but to help people who don't know as much about midwifery to implement a research study and how we can make a research study real in a clinical environment. So that's one example, but there are so many other things. We have midwives doing screening roles and lots of midwives working in research as well.
That's interesting. I've got a couple of friends with midwives and I would never have known the extent and scope of their role.
Yeah, I think people might be surprised to hear that you can be a midwife, but never actually even see a pregnant person. So we have midwives that are academics, for example, or midwives that are lecturing at universities, midwives that are working behind the scenes in risk and governance and looking after the safety aspect.
That's amazing. I would never have known that. So Fiona, how's your role as a midwife changed over the years? Because you've gone through quite a bit of a transition, haven't you?
I have. Before I even became a midwife, I was nursing. That nursing pathway was not academic, as we now have to undertake academic training to become a midwife. So the training was very different. It was very hospital based, and this is what you do, this is what we do. You would do some observation, you have a go, you get signed off. That really was my nursing background. And then when I started to explore midwifery, and it was much more academic, and that I was going to do the university pathway, I doubted that would be something that I could actually even contemplate. Moving forward 20 years, here I am. I've had various roles, community midwife, running birth centres, and then more recently, the last 6 years, joining a university hospital, which has a big emphasis on research and academic training, supporting lots of students, medical students and others. I saw some research that was happening at the hospital and became quite curious. Took the plunge, and the last 2 years I've been working as a research midwife, which was a real surprise to me to find that this is where I am, and to actually be working on a genomic study is an even bigger surprise. If you'd asked me 20 years ago that this is where I'd be, I'd probably have laughed and said, no, that's not something that I could even be contemplating.
That's fascinating. It's fascinating the journey you've been on and how midwifery and nursing training has evolved more broadly. So Jess, how does that compare with your own journey in midwifery?
Similarly, actually, off the back of what Katie and Fiona are saying, you do kind of go into midwifery thinking that your career is going to very much look like providing labour care and catching babies, which is a wonderful part of the job. And that is very much my background, is that I have been a labour and delivery midwife, usually on the birth centre or in the community doing home birth. And never in my wildest dreams did I think that I would pivot and go into something specialist. I think in my case, certainly I kind of fell into it quite literally, because I broke my ankle and then had to work from home for quite some time. I was offered to be off sick, and I was working at a new trust, and I kind of wanted to, so to speak, keep my foot in the door. And I said, there must be something I can do from home. And they set me up to do some auditing, which quite frankly, a few years prior, I would have, you couldn't have paid me all the money in the world to do auditing. And then lo and behold, I found it so fascinating, not just the process, but kind of seeing how that would kind of implement us in clinical practice. And now I'm a safety and quality improvement midwife. My office is on a birth centre though, so it does mean that I still very much work clinically. So a similar story. We're such a highly skilled profession that we can apply it in so many different ways. And now, of course, I'm on maternity leave with my third baby. So taking a little break, but really lovely to talk about it all today, actually.
Yeah, thank you. Thank you for sharing that. So as mentioned, alongside clinical care, midwives are playing this increasingly important role in research. Though it's something people might not necessarily realise and they might not associate with the profession, I'd love to explore what that actually means in practice and how midwives have become involved in this space. So Katie, where does research fit in with midwifery today, and how do midwives get involved in that space? And is that something that all midwives are engaged with? Or is it a more specialist kind of pathway?
It can be a specialist pathway, but I think what's really, really important to realise here is that every single midwife is involved in research, whether they realise it or not. All midwifery care has got to be evidence-based. Everything we do is evidence-based, because that's what keeps midwifery care as safe as it possibly can be. And we can only get that evidence base from doing research. So even if midwives aren't taking part in a research study themselves, if they're not, getting consent from people to do research studies, the care that they are giving comes from research that has been done in some space. Even if that's not within the UK, it's research that has been done. So research is incredibly important. That's how we evolve our care, how we evolve our pathways, evolve our guidelines is through that research.
So can you talk to the audience about what is a research midwife versus a clinical midwife?
So a clinical midwife generally is somebody that will have hands-on care during the antenatal, intrapartum or postnatal period. A research midwife, often that will be someone who still works on a ward in a hospital, but is helping to put research into place. So that may be running a study and taking consent from women to be part of that study and then doing whatever the study needs. Or it can be actually conducting their own research. It can be writing. It can be an academic form of midwifery as well. It's really, really important. And it really depends on the hospital and on the trust to how much that research is incorporated into the clinical care. And sometimes it can be quite separate, but both very, very important. And the Royal College of Midwives are really, really trying to work on making research part of general midwifery care. It's something that undergraduates need to do now as part of their degree, which all midwives have to do, a degree to become a midwife. They have to do research. They have to be involved in research. Midwives in their first year of being qualified should still be having a research role and looking at how research can broaden their clinical skills. And it's something that should be going on throughout their entire career.
Yeah, that's great. Fiona, what does a typical day look like in your kind of research focused role?
Firstly, just to say, when I moved from a clinical role into the research role, I thought I was going to miss that kind of adrenaline rush that does come with being a clinical midwife. And so I thought, this is so quiet. It's just a really very different pace. But actually, there are deadlines and things like that. So yeah, on a daily basis, it's a really busy day. So we can be answering our emails and inquiries about research. We're liaising with the clinical team. So I'm involved in a screening study. So we need to collect samples. So we go and collect samples. We register those samples. We're then approaching our patients or ladies that come in to have scans, or they might be in the antenatal wards. We liaise with the community midwives who might have people that want to take part in the study. So we do a lot of communication with the women through that way. Yeah, we are maintaining databases, so lots of data collection, and having the background as a midwife, having that holistic approach has really, really broadened, and really helped support my role as a midwife. Having transferring those skills has been incredible.
So what kind of studies do midwives support?
So apart from the genomic studies, a lot of genetic-based studies are going on within our trust, where they're looking at trying to understand why things happen and see if there's a genomic component that might be attributed to conditions. We've got observational studies where we use lots of questionnaires to ask patients about their experiences. We've got interventional studies, so that could be testing a new drug or an intervention, just testing something that might work and might build that into that evidence base to to put into practice. I'm really surprised at the portfolio of studies that is available. So they could be not just maternity based, but obviously obstetric based and studies, and we do a lot of gynae studies as well. So we work alongside the gynecologists.
So Katie, genomics is becoming more visible in healthcare. How is that showing up in maternity care more broadly?
So I think what's really important to note here is that genomics has always been really important in maternity care. It's just that midwives potentially didn't know that they were doing it. So from the very moment that we book a pregnancy, so when a woman has her first appointment at 8-10 weeks, we're already using genomics to plan her care. So we're asking about family history. We're asking about a predisposition to heart disease, for example, or heart conditions or diabetes, all things that we will then use to plan a pregnancy going forwards. We're looking at family history. We're doing screening, antenatal screening, which some of the tests there are genomic based. And then after the 20-week scan, for example, if we find some sort of congenital abnormalities, we can use genomic testing then to find out what is potentially wrong with the baby and what we can do about it. And then moving forward throughout that pregnancy, genomics is also really important in bereavement care. So if there's a history of multiple miscarriages, for example, or if a baby is stillborn, we can use genomic testing to find out any reasons for that and to hopefully improve care for that woman going forwards as well. The big thing that's going on at the moment for genomics in maternity and midwifery is newborn screening. At the moment, our newborn screening is looking for 9 or 10 different conditions, which are very rare, but do have some treatment if they are caught early. What we're doing with whole genome sequencing, genomic testing, is looking to see whether we can find a much larger range of conditions much earlier in the baby's life to see if we can improve outcomes for those babies. And so that's a huge role of genomics. Yeah, absolutely.
So Fiona, how confident do midwives generally feel about discussing genomics with families, even though Katie's just said it's not sort of nothing new and it's always sort of been there, maybe badged differently? How do you feel that midwives feel about talking about it when they are talking to families?
They probably don't feel very confident speaking about it, and I definitely wouldn't have been able to speak confidently as a community midwife role. But what is great about the hospital is that we know that they're where to refer to. So we've got the fetal medicine midwives who are available at any point to talk us through what to say to women or to help us. And the screening team are really useful and are on hand to, again, help us navigate that and what to say to parents. We've got a really good patient record system as well. So the notes are very accurate. We should be able to follow through from what the parents have been told already, what their journey looks like. So although we're not 100% confident, but I think the students coming through, they're going to acquire a lot more knowledge. And also our midwifery standards imply that genomics should be part of that everyday conversation that midwives are having. So although it isn't something that's familiar within our parlance, I think going forward, it definitely will become much more mainstay, if you like, just something that we will be naturally talking about because, let's face it, genomics is here. I want to say, being part of the Generations Study team, because I'm quite visible and everybody seems to know me because I've transitioned from one role to the other. We are visible. I'm stopped quite a lot, and midwives are asking the questions, and well, why is it important? Just even to be able to talk about, that we're building up a database data that's going to be used for for future reference. Being able to have those conversations with midwives now will really help that confidence. It's something that I didn't think I'd ever have a conversation with. I don't have very deep conversations, but I know where there are people if I do need to get those answers.
No, I think going with what Fiona says, I think it's really interesting that pregnancies generally now are becoming a lot more complex. We're seeing a lot more high risk pregnancies. And I think that we will find that women and their families, their knowledge of genomics is probably going to increase as well, because we're going to see genomic testing more widely in healthcare. And that's going to have to then flow through into maternity and into midwifery knowledge, because women are coming in with more of a baseline knowledge as well. And when we're dealing with more complex pregnancies and more high risk pregnancies, genomics is a huge part of that. Because we're going to be looking at things like pharmacogenetics, where we can see what kind of treatments are going to be best for these women and how that can then impact on their pregnancies. I think epigenetics is becoming more and more talked about and more interesting in maternity, and it's really important that midwives are aware that we've been speaking for years about the impact of smoking, alcohol, all of the outside factors on a pregnancy. But when we actually consider that from a genetic point of view, and that these genetic changes could potentially then be feeding down through generations, it brings a whole new level to that aspect of maternity that midwives do need to know about. So I think Fiona's right. I think that there is a lack of confidence when you hear the word genomics, but as soon as you explain what genomics actually means, then that confidence can be boosted. And I think that as we go forwards, there's so much work being done in the training and education systems for universities, for midwives that are already practicing. We're really trying to improve that confidence and competence within the generation study. That's something that we're working really, really hard on, is to make sure that we're giving all the really appropriate training to the midwives that are involved in it. And that's not just the research teams that are asking consent from the participants, but that's for the wider team as well, to help the midwives who are taking samples, for example, understand why they need to take that particular blood sample, the importance of taking it at the time, and what that means for the family and how that can impact on the future.
So it's kind of a whole literacy raising across the piece, isn't it? And
absolutely,
just to sort of go back to a couple of things you said there, for those who might not know, who are listening, would you mind just explaining about pharmacogenomics and epigenetics? Because I just wanted to make sure that we put it across for everyone who might not know those terms.
So epigenetics, for example, that's looking at how environmental factors can influence gene expression. So how the impact of something on the outside can impact what's going on in the inside. And we do know now that environmental factors can change the way that your genes in your body work. So that can not only impact the individual, those gene changes can be passed down through to next generations as well. And we know that this can happen across the placenta. So what a mum does in her pregnancy can then change the gene expression of the baby as well. And then we've got pharmacogenetics, which is looking at how certain drugs and certain treatments can be individualized for personal care. So looking at a person's genome, looking at the way their individual genes all work together, and then seeing how specific drugs, specific treatments can be used for that individual rather than as a population level.
That's really helpful. Thank you. So Jess, did being a participant on the generation study change how you approach conversations as a midwife? Because you're kind of like in both camps, which is a quite rare and interesting position to be in.
Yeah, it's been a really amazing insight, actually. It definitely will. And I think this will kind of piggyback off of what Fiona was and Katie was saying about how confident are midwives when they're counselling for studies. So, I'm particularly passionate about, I mean, mostly all midwives are, but I'm very passionate about ensuring that the people that we're providing care for are making truly fully informed decisions, like very informed, not just signposting, but making sure that they understand, what does this mean for you? Like, what could these results mean for you and your family? Because I think this is a wonderful approach in some ways, but very often will be met with people under our care that go, yes, of course, like sign me up for absolutely everything. Like the more we know, the better. And actually, I think it's then having that discussion about, well, actually, knowing things can be very complex, because it then opens up a lot more questions for you and your family. And not suggesting that ignorance is bliss, but actually, really ensuring that they truly understand what this could mean for them and for their babies, and the positives of that as well. What this could, how this could really optimize your child's health throughout their life. And so for me, I've always been very passionate about discussing studies with the people that I'm caring for. But it was really amazing actually being on the other side and applying that to me and my family and my baby. I talk about this, every day. And actually, Fiona's right. They're a very visible team, and it's amazing because, well, for Fiona, because often if she's on the birth centre or and a bell goes, she's often having to get stuck in clinically in emergencies anyway. So you get a little touch of that every now and then, don't you, Fiona? But it means that they are very accessible. I felt I had a really good understanding, but suddenly it felt very personal. And I can't quite remember how it went, whether Fiona approached me or I approached her, because we see each other so frequently at work. I think that when my pregnancy became, common knowledge, correct me if I'm wrong, Fiona, it was more of a like, oh, here we are again meeting in a corridor. Oh, yay, I can do the study type of thing.
I think you came and sat in my office to do the consent.
And that was a really interesting part for me because, of course, as a midwife, you don't get to see behind the curtain, so to speak, as much as what I got to do as a participant. So I got to come and sit with Fiona in the office with the team. It was wonderful from the perspective as a pregnant person, but also as a midwife, I've learned quite a lot. And I think that, of course, I'm not at work, currently, but when I return, certainly the way in which I signpost and the way that I talk about research and the generation study in particular, all of that will still be there, but I do wonder if there's a much deeper understanding on my side. And I think undoubtedly that's probably going to, I will adapt how I then talk to people about the study, because I've, had more of an opportunity to delve into, some of the great stories that have come out of it and some of the real successes that have been shared from the team. I think there was very recently a case where a genetic condition was found, but it was found so early that actually his quality of life is now going to be, really optimal. And I just found the whole story really fascinating. So I suppose it's opened a bit more of a door for me on a personal side and a professional side to read more. And I found it, that much more intriguing, I suppose.
Yeah, I suppose it piques that curiosity, and also just hearing those good news stories, kind of showing how, a family's life has been impacted in such a sort of the early part, instead of having that massive journey of finding out what possibly could be the challenges a child is facing and not knowing. Having that result so much early on makes such a difference to a family.
Absolutely. And also just, I think as well, because I work in safety and quality, a huge part of my role is looking at patient experience. It's been great to be on the other, yes, this is third time around, but this was the first time that I had a baby at this current trust that I'm working at. So, it was really great being on the other side of that and actually seeing how streamlined it was, how the communication between the research team and myself as the pregnant person, how efficient it was, that I was receiving various things in the post and through the kind of patient portal that we use, and then how swift the results were as well. I'm sure that can vary between participants, but for me, you're so caught up in the newborn weeks that you can almost forget you were part of a study. And then I got the results through and I went, oh my gosh, of course. What a wonderful thing to participate in. And the fact that we're still a part of it really until he's 16 years old and beyond if he consents. So I just think, it's been a really great experience to participate, but it will undoubtedly change how I then talk about it moving forward because I've had this personal experience.
Yeah. Kind of hearing that seamless experience kind of builds on the trust that, you have in the study and the sort of people behind it essentially, which is really important when you're kind of giving your genomic data essentially. So it's really good to hear that.
Yeah.
So looking to the future, it's clear that genomics is going to play a growing role in healthcare. So I'm really interested in what that means for midwifery. How might the role evolve, and what does that mean in terms of supporting midwives who need to feel confident in this space?
I think that genomics is going to have a huge impact on maternity care, and I think it's going to be really great to see how we can really improve the personalised care that we give to individuals that come through the maternity system. We try really hard as midwives to treat every single woman that comes through our care as an individual, to personalise her care plan. And the more information that we've got about somebody, the more information they want to share, the better we can look after them and the better care plan we can actually put in place. So by using any genomic data that we have, we can really improve that care. If whole genome sequencing does become part of newborn screening in the future, we can potentially find these babies every day that we think may have a rare condition, and we can do something to improve their quality of life.
Yeah, that's incredible. If the study continues and rolls out into healthcare, that will be such an impactful and really game-changing effect for everyone.
It will be really impactful and game-changing as long as we do it properly. And I think what Jessica was saying was really, really important about genomics can have huge implications for families and for people. So it is so important that people understand what they're signing up for in any kind of genomic testing, not just in the generation study. And because of that, the training that we give to midwives in the future, and I say we, I mean that as universities, as midwives teaching each other, as all education bodies, the information and the education that we give to midwives is so important, because the only way that we can ensure that the individuals signing up for any kind of genomic testing are giving informed consent is by making sure the people taking that consent are fully informed as well. As going forwards, if all midwives can just embrace genomics, everybody will help each other build to a position where we can provide really, really good care.
From the perspective of, yes, a midwife, but also someone that's fairly freshly postnatal, decision-making during a pregnancy is actually really complex. There's a lot of grey areas. And I think that decision-making, that can be really tough if it's your first experience, or if you're suddenly dealing with something in a pregnancy that is more complex than you anticipated, and there's no right or wrong answer, and you're having to make decisions with perhaps not quite all of the information. I mean, Katie touched on the non-invasive prenatal testing when we are, we're screening in early pregnancy for a number of conditions. But the non-invasive prenatal testing, it's not 100%, but it gives us a lot more to work with. And I think everyone interprets risk differently, don't they? So if you're given a 1 in something chance that your baby might have a condition, it can be really difficult and a very emotional process to make decisions around that. What's my next move going to be? So if we have the ability with genomics to actually provide a lot more information and kind of broaden the decision-making process, then that can only, I think, be a positive thing. Or give them the opportunity to then opt out of any further testing, which is equally as important.
Giving you as much agency to choose without pressure, and just giving you as much knowledge that you need to make the best decision that you can in that situation.
Yeah, the situation that's right for you and for your family, which is going to look different for every family, isn't it?
And midwives are in such a privileged position because of the amount of time that we potentially spend with a woman, and to get to know that woman. We have got the ability to actually explain things in a way that woman may be able to understand as well, as long as we've got the knowledge. So, genomics can be really, really complex, and it could be really difficult for people to understand, even if we do have all that information. So by using the relationships that we can build with those women, I'm thinking particularly community midwives or people during the labour room that are building these really intense relationships really, really quickly, we really need to be able to use that to our advantage when it comes to actually information given to patients as well, and to women and their families.
We're in a really unique position in our profession because we're very highly skilled at having to explain something quickly and under pressure and try and capture and provide all of the information possible. But also we work as part of a multidisciplinary team. So we've got access to a lot of professionals that can provide input and help with educating the patient, but also educating us. So our knowledge is always growing, especially around kind of research and genomics in particular. Yes, it's becoming so much more a part of midwifery. So I think, I feel really lucky that, we're not just in a profession that, we do this day to day and that's it. It just feels like that there's always a chance to learn and to grow as a professional and then impart that on the people that we're caring for.
So coming to my final question, if you could leave our listeners with one message about midwives and research, what would it be?
I'd say, even though it does sound like it's a scary, subject, I think we need to embrace it. The technology that's there, we've got it. It's here to stay. Yeah, just don't be scared. Be curious and excited.
Yeah, and I do think, I think midwives in general, I feel like when we qualify, we also qualify with a bit of an inferiority complex, that we worry about what we don't know. And actually, you're right, Fiona, we really mustn't be scared of this. We carry so much knowledge. Our profession is, as we've already spoken about, it's amazing how much we actually do as midwives and how broadly we practice, that actually it's absolutely okay if we're not confident in delivering this information or we're not confident about, where research is going. The most important thing is accessing support so that we can make sure that we are, for ourselves and for the people that we're looking after, we have as deep of an understanding as we possibly can.
Definitely. And talking about sort of multi-skilling and being kind of pretty amazing, Jessica, I'm very impressed with our guest that has joined us on your shoulder.
The generation study baby.
Generation study baby that you've done this entire podcast with your
He's done amazingly well, hasn't he?
He's done very well, and that really does sort of show the power of your skills, not just a midwife, but also as a mum, as we know.
Always a juggle.
It certainly is. Katie, did you want to add any more about leaving our listeners with a message about midwives and research?
Yeah, Fiona used the word curious, which I think is brilliant. I think if we can all be curious about research, we're already onto a winner. And Jessica said about being brave. The more brave we are as midwives and the more that we're willing to be curious about what we can do to improve our care, the better we're going to be at our profession. All midwives want to do is to provide safe, effective care that is what is in the best interest of that woman. We are advocates for women and for their families. We want what they want. But in order to do that, we have to embrace research along with safeguarding and health and safety. I feel like it needs to be everyone's responsibility. We all have this responsibility to improve care for the women that we're looking after. And research is at the heart of that. And the more research that we can do, that we can be part of and that we can implement, the better that our profession will be and the safer that our women will be.
Thank you to our guests, Katie, Fiona and Jessica's newborn baby, for joining me today and sharing your insights into the evolving role of midwives. It's been fascinating to hear how midwives are not only supporting families day to day, but also contributing to research and helping to bring genomic medicine into routine care. If you'd like to hear more like this, please subscribe to the Behind the Genes on your favourite podcast app. Thank you for listening. I've been your host, Sharon Jones. Behind the Genes is produced by Deanna Barak, Florence Cornish, Sophie McLaughlin and Patrick Wallace at Bespoken Media.